Welcome to the first part of our training, which is the mobility program. We will start first with bed mobility without draw sheet. Okay, first, we will do the side-to-side positioning of patient without using any draw sheet. First, you will place your hand on the upper back of the patient. And then you will push the patient to one side. You will pull the patient to one side. And then transfer your hands to the lower back and to the pelvis region. And then pull the patient to one side. And then the lower legs. Okay. It is very important to position the patient on one side before doing the side lying positioning. Okay, so in doing the side lying positioning, we will move the right arm in 45 degrees outward abduction, while we will bend the left knee and then place the left upper extremity across the chest. So the therapist will place his hand on the pelvis and at the same time on the shoulder, and then he will pull it toward himself. It's very important to position in front of the patient wherein you will do the side lying. It is for protection of the patient, and as well we are getting more of mechanical advantage of using our power and strength. Okay, now we will go to moving the patient upward in bed without using any draw sheet. Okay, let's place the patient again in supine position. So while the patient is lying, we will place both upper limbs across his chest, and then the therapist will place his one hand on the upper back and the other hand on the pelvic region. And then he will move the patient upward. Okay, that's it. So it's very important, if we are using hospital bed, to bring low the head of the bed before doing this positioning. Okay, we will now go to the bed mobility using a draw sheet. Okay, see you. Okay, now we will do the bed mobility using a draw sheet. If you don't have a draw sheet, you can use a bed sheet or a big towel, or you can improvise. Like this one. We will use a blanket, and then we will use this as our draw sheet. So first, you will measure. It should be beyond the width of the shoulder of the patient and the pelvis. And the length should be from the upper back and then just beyond the pelvic region. In order to insert this, you will fold this first in half. Okay, down to the middle of the draw sheet, and then as we learned earlier, we will do the turning from supine to side lying. Bend the knee, move the one arm in 45 degrees, one arm across the shoulder, and then we will turn the patient. Okay, and then we will insert the draw sheet up to the middle of his lap. Okay, you can lay down now. Okay, now we will turn the patient on the other side, bend the leg, hand across the chest, and then the therapist will move the patient on the side lying position, and then it's very easy. You can just bring the bed sheet on its proper position. Okay, now in moving the patient from side to side using the draw sheet. So it's important to have a teamwork. One will give the command and the others will follow, like this one. So first, we will move the patient from the towards the left side using the draw sheet. Okay, be sure to hold the draw sheet. And then you can even include the pillow. Okay. At the count of 3, we will move the patient toward me. 1, 2, 3. Okay, that's good. Now, in moving the patient to the right side, the same procedure applies. At the count of 3, move the patient. 1, 2, 3. Okay, that's good. Now, in moving the patient upward in bed, be sure to lower down first the head of the bed, and then we will bring the patient upward. Okay, at the count of 3, let's bring the patient upward. 1, 2, 3. Okay. Okay, that's all for bed mobility using a draw sheet. Now we will do the bed mobility which is partially dependent or active assisted bed mobility. See you. Now we will move on to our next training. We will teach the patient on doing bed mobility partially assisted or partially dependent. Okay, this time, let us assume that the patient case is CVA with hemiparesis or hemiplegia. The affected side is the right side. Okay. First, we will do the side bed mobility movement. So, since the patient's strong side is his left, we will instruct the patient to bend his left knee and then bend his left elbow. We will assist the right leg. Okay, instruct the patient to lift his pelvis and then move to the left. Okay, move to the left. Okay, that's it. And then instruct the patient to push down his elbow and then move his upper body to the left. Okay, that's good. Now, in this position, let us now go from supine to side lying, partially assisted. Okay, move your affected leg straight. Move the affected arm in 45 degrees. Okay, instruct the patient to reach the side of the bed while pushing your body into side lying position. Okay, reach the side of the bed. Okay, that's it. Be sure that there is enough space in which the patient will turn. And then, from side lying to sitting position, instruct the patient to assist the affected leg down to the edge of the bed, down to the edge of the bed. Okay? And then instruct the patient to push himself up. Push himself up. Okay, that's it. Be sure in assisting the patient, do not support the head. You support the shoulder. No, not this one. Okay. Now we will go to the active bed mobility movement. Okay, see you. Now we will go to the active bed mobility. But this time, of course, with therapist or caregiver supervision. First, we will do the active side-to-side bed mobility. Okay, instruct the patient to bend both his knees, bend both his elbows. Okay. In moving to the left, instruct the patient to move first his hips towards the left side of the bed. Okay, up and move. Okay. Now, bring your left elbow outward, the right elbow close to the body. And then, push down and move your upper body towards the left side. Okay, now, let us do the going back to the starting position. Okay, in going to the right side of the bed, the same procedure applies. Raise your both hips towards the right, and then push down your elbows towards the right. Okay. Now, we will do the active moving upward in bed. Okay. First, instruct the patient to bend both his knees, and then bend both his elbows. Okay. While the elbows are bent, instruct the patient to lift his upper body upward. And then push both limbs and then upward. Okay, that's it. Okay, Now, assuming, let's go back to the supine position. If the patient case is spinal cord injury, in doing the supine position to sitting position, we will instruct the patient first to shift his weight to the right side. Okay. Shift your weight to the right side, upper body, and then shift to the left while pushing yourself upward. Okay. Until your elbows were completely extended. Okay, now in that position, the patient will go to the sitting dangling position. The patient will move his legs slowly, one at a time. Okay, good. One at a time. Left, right, left, right. Okay, that's it. Okay, now, that's all for the active bed mobility. See you on our next portion. Now we will go to the next portion of our training, which is the different transfer techniques. First, we will do the transfer from stretcher or gurney to bed using two-man team. Okay, so this time we will use the transfer sheet in transferring the patient from gurney to bed. So it is important to have teamwork. The one that has the greater burden will give the command. Okay, now let's do the transfer. Okay, first hold the transfer sheet above and then below at the level of the hips and at the level of the shoulder. Okay, the one that has the greater burden will be Sir Lucas, and he will give the command.
Okay, at the count of 3, 1, 2, 3, go.
Okay, that's it. So that's it, and then we will go now to the next technique of our training. See you. Now we will go to the next technique in transfer. This time we will do transfer from wheelchair to bed, maximum assist, two-man team. In transferring the patient from wheelchair to bed, be sure that the wheelchair is close to the bed, and then be sure that the patient is facing towards the foot of the bed. Okay, the same procedure applies. The one which has the greater burden will give the command. Okay, first, the therapist at the back of the patient will move his hands underneath the patient arms, and then be sure to hold the patient forearms, while the other therapist or caregiver will support the lower limbs. Okay, applying the principle of proper body mechanics. Okay, Sir Lucas will give the command.
Okay. Count of 3, 1, 2, 3,
Go. Okay, so that's the proper way. This time we will do the transfer from wheelchair to bed using two-man team. Be sure to position the wheelchair close to the bed, and then be sure to position the patient facing the foot of the bed. Okay, so that the therapist or the caregiver at the back will insert both his hands underneath the patient arms and then hold to the patient forearms. And then the other therapist or the caregiver will support the lower limbs. So the same procedure applies. The one with the greater burden will give the command.
Okay. Count of 3, 1, 2, 3, up.
Okay. So the same procedure applies in bringing the patient back to the wheelchair. Okay, let's position the patients in low sitting position. Okay, so the therapist at the back will insert his hands underneath the patient arms and support the forearms. So the other therapist or caregiver will support the lower limbs. So Sir Lucas will give the command.
Okay, again, after the count of 3. 1, 2, 3, go!
Okay. Now we will go to the next part of our transfer techniques. See you. Now we will do the transfer from bed to wheelchair. This time our case is CBA right hemiplegia. So the affected is the right side. So in transferring the patient to the wheelchair, first instruct the patient to scoot forward while the therapist is assisting him. Okay, so the therapist will assist the patient in scooting forward. And then be sure to position the wheelchair in 45 degrees. It is much easier. And then remove the side rail. And then be sure to lock the wheelchair. Okay. So the therapist will place his hands on the patient's hips. And then he will brace his knees to the patient's knees. We will do the pivot transfer. Okay, now let's try. Reach the side of the rail with a good hand and then transfer. Okay, so it is better to position the patient in transferring towards the non-affected side or the good side. Now, in bringing the patient back to bed, this time let us assume that the affected side is the left side. Okay, so the same procedure applies. We will assist the patient in scooting forward. And then the therapist will brace the knees, hold on to the back, to the lower back, and then do the pivot transfer. Okay, that's all for our moderate assisted transfer. Okay, let's move now to the next training. We will now teach the patient on how to do independent transfer from wheelchair to bed. Our case now is spinal cord injury with the patient having paraplegia, paralysis of both lower limbs. So first, if the bed is in level with the wheelchair, there is no need to use of sliding board like this one. Okay, now, assuming that I have given instruction to the patient, let us watch on how he will transfer from bed to wheelchair. Okay, scoot, using both your arms. Okay, good. Reach to the handrails and then slide down. And then in going back, the same procedures apply. The patient will make use of his strong upper arms and then slide to the bed and then sit down. Okay, now on our next segment, we will show you if the bed is higher than the wheelchair on how the patient with spinal cord injury will transfer. Okay, see you. Now I will show you if the bed is higher than the wheelchair. I will show you how an SCI patient will transfer from wheelchair to bed and then from bed to wheelchair. Okay, first, be sure that the wheelchair is close to the bed, and then make sure you have instructed the patient in detail on what he will do. Okay, so first, the patient will lift his whole body using his both arms upward. Okay, and then scoot towards the bed, and then sit down straight. And then in going back, the same procedures apply. So the patient will hold on to the side handrails, and then push himself up, reaching for the side rails, and then go back to the wheelchair. Okay, that is how a patient will transfer from wheelchair to bed. Okay, now we will go now to our next segment. See you. This is now the next part of our mobility program, with is sitting mobility. So what is important in sitting is first to develop the patient's sitting tolerance. So without any movements, you will develop first the sitting tolerance by having the patient seated for as tolerated. Once you have developed the sitting tolerance of the patient, then you can now start in sitting balance mobility or exercises or activities. The first thing we will do, and we will instruct the patient, is put both hands on your thigh. Okay, place your hands on your thigh, and then while seated, try to look on either side. Look to the right as far as you can. Look to the left. Okay, you can move now your shoulder. While looking sideways, yun. Ulit. So the next part of our mobility program is sitting mobility. So it is important in sitting mobility that to first start with the patient's sitting tolerance. At first, there will be no activities or movements, just to develop the tolerance as long as the patient can tolerate sitting. After you have developed sitting tolerance, then we will do now the sitting balance activities. First, we instruct the patient to put both hands on your thighs, and then the first mobility would be to look on either side. Okay, head and shoulder, right and then left. 1, right, and then left. 2. So after that, we will now do the scooting forward and backward mobility. Okay, instruct the patient to scoot backward and then forward. Okay, that's it. And then next mobility activity would be reaching with one hand in all directions. Okay, patient, try to reach forward as far as you can, and then reach backward, sideways, and then reach backward. Okay, that's it. Now do it on your left arm. Forward, sideways, and then backwards. Okay. We can start in 10 repetitions for each mobility activity. And then the last one, while seated, you ask the patient to lean forward with body straight. Okay? Shoulder in level with the knee. Okay, lean forward and then backwards. Okay, 1, forward, and then backwards. Okay, 2. That's it. So now we will go to the standing mobility program. See you. Okay, now we will go to the standing mobility program. So once we have developed the sitting tolerance and balance, we will now proceed to standing tolerance. First, the technique for getting up from sitting position is first, instruct the patient to scoot forward, and then instruct the patient to lean forward, and then push himself up. Okay, that's it. Now, assuming the patient has standing tolerance, we will now proceed to standing balance exercises. The first activity we will do is weight shifting. Okay, you will instruct the patient to put his weight on the right leg and then shift to the left. 1, right, left, 2, 1 more, and then 3. Now, after that, you will instruct the patient to step his right foot forward and then shift the weight forward and then backward. 1, 2, 3. Okay, bring back your right leg and then step your left foot forward and then shift your weight forward and then backward. 1, 2, 3. Okay, bring back your left foot. Now what we will do is looking on either side. Okay, turn to the right and then to the left. 1, 2, one more, 3. Okay, the next one will be reaching with one hand in all directions. Okay, reach forward, 1, sidewards, 2, and then backwards. Okay, do it with your left arm, forward, sideward, and then backwards. Okay, and then the last one in standing balance exercises would be walking forward and walking backward. Okay, instruct the patient to face this way. Okay, now with support or standby assist, instruct the patient to move forward 3 steps. 1, 2, 3. Okay, step backwards. 1, 2, 3. Okay, now you can sit down. So for lessening the amount of time in doing this program, we just limit the repetitions to 3. Okay, then I'll see you again on our next segment. Let us now go to our gait training portion. I would like to impart to you the general considerations in using different assistive devices. First, stay on the posterolateral side of the patient or on the weaker side for support and standby assist. Number 2, make sure that the patient's elbow is in 20 to 30 degrees flexion when using any assistive devices. Okay, let us now go to the actual training. See you! Welcome to our walker gait training portion. This time we will instruct the patient to stand up from sitting position using a walker. The case is the patient's affected leg is his right leg, non-weight bearing or partial weight bearing. First, you will instruct the patient to scoot forward a little bit and then hold on to the walker, and without putting weight on his affected leg, lean forward, make sure that the shoulder is in level with the knee, and then push your body using your arms. Okay, that's good. So the same procedure applies when you are instructing the patient from standing to sitting position. So instruct the patient to move backward until his good leg touches the edge of the chair. And then the same, lean forward first, not putting weight on the affected leg, and then move slowly downward. Okay, and then scoot back. Okay, that is from sitting to standing and standing to sitting position. Let's see you in another portion. We will go now to the actual training using our walker. So first, standing from sitting position, like what we did before. Okay? Patient, let us now stand up. Okay, that's good. And then, the pattern that we will use is swing to gait pattern. Non-weight bearing or partial weight bearing on the affected leg, which is the right leg. Okay, instruct the patient to move the walker 1 step away. And then bad leg, and then good leg. Okay. Walker, bad leg, and then good leg. Walker, bad leg, good leg. Okay. Walker, bad leg, good leg. Walker, bad leg, good leg. And now we will do the turning. The same procedure applies. Walker, turn the walker slowly. Bad leg, good leg. Okay, walker, put your weight on your arms. Bad leg, good leg. Walker, 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 bad leg, good leg. Okay, that's it. Now we will go now to using the walker in unlevel surfaces like ramps. See you. Okay, this is now the portion that we will teach the patient in using walker in unlevel surface like this ramp. Be sure to instruct the patient to make a little bit movement first. Small steps, small movement of the walker. And be sure to instruct the patient to lean slightly forward. That is for stability and to lower down the center of gravity. The pattern that we will use in going upward is walker first, and then the good leg, and then the affected leg. While in going downward, we will do the pattern of walker first, bad leg, and then the good leg. The rule of the thumb as therapists, we are using good, go to heaven, and bad, go to hell. So, for easy memorization of the pattern. Okay, let's start now with using the walker in going upward. Be sure to stay on the posterolateral side of the affected side of the patient. Okay, instruct the patient to move the walker slightly forward. And then the good leg, small step, and then the bad leg. That's good. Walker, good leg, and then bad leg. Walker, good leg, and then bad leg. Now, assuming we are now going downward, okay, let's turn. Assuming we are now going downward. Okay. So this time, I will stay on the anterolateral side of the affected leg for support and stability. Now, the pattern that we will use, as I said before, walker first, bad leg, and then good leg. Now, instruct the patient to slightly lean backward to lower the center of gravity. Okay, now let's move the walker slowly forward. Bad leg, and then good leg. Walker, bad leg, and then good leg. Walker, bad leg, and then good leg. Okay, that's it on our training on unlevel surface. See you on next portion. We will now go to the next part of our gait training. This time, we will use a pair of crutches. First, we will instruct the patient to move from sitting to standing position. So, let us assume that the case of the patient, the affected leg is the right leg again, partial weight bearing or non-weight bearing. So, in instructing the patient to stand up from sitting position, first instruct the patient to put the crutches together on the dominant hand. And then instruct the patient to slowly scoot forward without putting weight or partial weight on the affected leg. If the chair has an arm, the patient can use the arm in pushing himself upward. But if not, if there is no arm, the patient can use the side of the chair in pushing himself upward. So this time, instruct the patient to slowly lean forward, shoulder in level with the knees, and then slightly push himself upwards, pushing the weight on the arms. Okay, while standing, transfer the other crutch on the other side. Okay, be sure that the clearance of the crutch support from the axilla is 2 finger breadth, like this one. And be sure to stand in a tripod position, meaning 4 inches anterior, 6 inches lateral to the toe. Okay, now let's try from standing to sitting position. Okay, let's place both crutches together on the dominant hand, and then instruct the patient to lean forward slowly, reaching to the edge of the chair, and then slowly put himself down, and then scoot backwards. Okay. Now we will go to the actual training program. Okay. This time, we will go to the actual training crutch using program. In using crutches on level surfaces, there are 4 techniques that we are using. First is the 3-point gait. Next is the 4-point gait. Next is the 2-point gait and the swing to and swing through pattern. Let's start first with the 3-point gait. With the affected leg in partial weight bearing or not non-weight bearing status. Okay? As we are doing before, stay on the posterolateral side of the affected leg, and then instruct the patient to move both crutches one step forward. Okay? Crutches, bad leg, put the weight on your arms, and then the good leg. That's good. Okay, crutches, bad leg, and then the good leg. Crutches, bad leg, and then the good leg. So that is what we call the 3-point gait. Now we will go to the 4-point gait. No. This is stable, but it took longer than the 3-point gait. First, let's move the left crutch forward. Left crutch, affected leg, right crutch, and then the good leg. 4-point gait. Left crutch, affected leg, right crutch, and then the left leg. Okay, 1, 2, 3, 4. 1, 2, 3, 4. So that is our 4-point gait. The 2-point gait is much easier and lesser time. This time, the left crutch and the right leg or the affected leg will move at the same time. Okay, left crutch and right leg, and then right crutch and good leg. Okay, 1, okay, and then 2. Okay, good. 1, and then 2. So that is our 2-point gait. Now we will go to our swing to and swing through gait. So the term implies when we do the swing to, the patient moves the crutches forward, but while he moves both legs forward, he will not pass through the crutches. Swing to. And when we say swing through, the patient will move beyond the crutches. Okay, let's try. Okay, instruct the patient to move both crutches forward, and then don't go beyond both legs. Okay, that's good. Crutches forward, don't go beyond. Okay, that's good. That is the swing to. When doing the swing to, the patient will move both legs forward beyond the crutches. Okay, let's try the swing through. Okay, that's good. Next. Okay, so that is our techniques in using our crutches. Now we will teach the patient to use the crutches in going on level surfaces and stair. See you. This time we will teach the patient in using crutches in level surfaces like this ramp. So the same techniques apply. When going upward, good leg first. And when going downward, bad leg first. Okay, now let's do it. Okay, first instruct the patient to move the good leg upward, bad leg, and then crutches. Okay, that's good. Good leg, bad leg, and then crutches. Good leg, bad leg, and then crutches. Good leg, bad leg, crutches. Be sure while doing this, before doing this, to instruct the patient to lean forward a little bit for stability and to lower down the center of gravity. Now, assuming we will go down this ramp. Okay, let's turn. Okay. This time we will teach the patient in using crutches in going down this ramp. Okay, our technique is crutches and bad leg and then good leg. Be sure to stay on the anterolateral side of the affected leg for support. Okay, and then be sure to instruct the patient to lean backward slowly and a little bit. Okay, now let's move both crutches and bad leg at the same time. Crutches and bad leg. Okay, that's good. Good leg. Okay. Crutches and bad leg, and then good leg. Crutches and bad leg, and then good leg. Crutches and bad leg, and then good leg. That's it. Next, we will teach the patient to use the crutches in going up and down the stairs. See you. Okay, this time we will teach the patient to use crutches in going up and down the stairs. So our technique in going upward, is good leg first, and then bad leg and crutches. In going downward, crutches and bad leg, and then the good leg. So be sure to stay on the posterolateral side of the patient, on the affected side when going up, and the anterolateral side in going downward. And be sure to hold on to the guard belt. That is important in providing support. Okay, now let's teach the patient going upward. Good leg, and then bad leg and crutches. Okay, good leg, bad leg and crutches. Okay, good leg, bad leg and crutches. Good leg, bad leg and crutches. Now, assuming, now we will go down the stairs. Now we will teach the patient in using both crutches in going down the stairs. Okay, crutches, bad leg, good leg. Okay, crutches, bad leg, good leg. 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 That's it. So now we will go now to the other portion of our gait training, which is using quad cane. See you. We will now teach the patient on how to use the assistive device which is called cane. First, it is important to teach the patient from coming to standing from sitting position. Okay, now we will instruct the patient first to scoot forward and then move the affected leg, which is the left leg, forward, and while the right leg is backward. Okay, and then instruct the patient to push himself up using both his arms. Okay, then come to a standing position. Okay, now, in going from standing to sitting, you will instruct the patient to move or step backward until the back of his knee touches the edge of the chair. Okay? Move your left leg forward, the affected leg forward, and then slowly sit down. Okay, and then scoot backwards. Okay. Now we will teach the patient on how to use the cane using the most stable pattern. Okay, now let's practice again. From sitting to standing, scoot forward, and then lean forward, and then stand up. Push yourself up. Okay, balance. Okay, the first pattern we will use, move the cane first forward, the affected leg, the left, and then the right. Cane, left, right. Cane, left, right. Okay, that's it. Now, to progress this pattern, we will use the 2-point gait. The left leg and the cane will move simultaneously. Okay? Cane and left leg, and then the right. Cane and left leg, and then the right. Cane and left leg, and then the right. Okay, that's it. Now we will teach the patient on how to use the cane in a level surface, the stairs and ramps. See you.
Go.
Now we will teach the patient on how to use the cane in going up on a level surface, this time which is the ramp. Okay, the therapist will stay on the affected side of the patient, on the posterolateral side for support and standby assist. Now, we will instruct the patient when moving up, our rule of thumb, good, go to heaven, bad, go to hell. So instruct the patient to move the good leg forward and then the bad leg and the cane. Okay? Good leg, cane and bad leg. Okay, that's good. Good leg, cane and bad leg. Good leg, cane and bad leg. Now, we will teach the patient on how to use the cane in going down the ramp.
Cut.
Now, in going down the ramp, we will instruct the patient to move his body a little backward to counteract the pull of gravity. Now, let's move the cane forward, the affected leg, and then the good leg. Cane, left, right. Cane, left, right. Cane, left, right. Okay, that's it. So that's how we use the cane in ramps. Now we will use the cane in stairs. Now, we will teach the patient in using the cane in going up the stairs. Now, we will instruct the patient to lean forward a little bit. Okay? And then, move the good leg upward. It is the right, and then cane, and then the left. Okay, that's good. Good. Cane, and then the affected. Very good. Cane, and then the affected leg. Okay, now we will teach the patient in going down the stairs. Now we will teach the patient in using the cane in going down the stairs. First, instruct the patient to move his body a little bit backward. And then, the technique is cane and bad leg, down, and then the good leg. Cane and bad leg, down, and then the good leg. Cane and bad leg, down, and then the good leg. Okay, that is the technique we will use and the pattern we will use in using the cane in going down the stairs. So that's all for our gait training. See you in our next segment.